Hi, and welcome to the mini class on the 4 top foods to heal your patient's gut. My name is Tal, and I'm the Educational Director at the American Academy of Functional Health. And in this class, we're going to learn strategies and nutritional protocols for supporting healthy gut function, metabolism. And this is really important because I typically say that the gut is the foundation of good health. And there's a lot of really interesting studies that came out in the last couple of decades that are talking about how our gut is really important for immune function and modulation, for mood regulation, hormonal balance, healthy metabolism. And there are several signs and symptoms that your patients might have that could indicate that they have a problem with one of those aspects of their gut. The clearer and most simple to identify signs and symptoms are chronic bloating, digestion discomfort, abdominal discomfort, right? All the way to inflammation in the gut or systemic inflammation, and food sensitivity, reacting negatively to certain foods, or if they have nutritional deficiencies. Additional factors or signs and symptoms that your patients might present are persistent bloating, gas. It could be irregular bowel movements, for example, constipation, diarrhea, IBS, patients with IBS. Sometimes skin disorder through the gut-skin axis. So patients that have eczema, psoriasis, acne, we got to look at what's causing that inflammation from the inside out, not just applying topicals, right? Also, unexplained fatigue or brain fog, sometimes that is explained through the gut-brain axis. And then, of course, I mentioned inflammation such as chronic joint pain or a diagnosis of autoimmune conditions. We found that so many of those patients have some sort of involvement of the gut. So I got a whiteboard here. I wanted to share with you when we're talking about the gut, right? There are multiple aspects that as a functional medicine practitioner, you're learning about to really dive deeper, right? And we always like to take a much more comprehensive approach to really be able to identify for the patient in front of us if it's weight gain, type 2 diabetes, arthritis, mood disorders, hormonal imbalance. We want to understand these root cause systems so we can provide the appropriate recommendations. I'm going to draw here the gut, right? And again, when we talk about gut health, there's multiple factors we want to talk about. The first one, obviously, which we all know of, is the microbiome, right? The microbiomes it's a whole ecosystem of bacteria that live in our gut, right? So we have a whole ecosystem, bacteria, fungi, different organisms, trillions of organisms that have multiple functions. It's also important to look at, and of course in functional medicine we dive deeper into identify which one of those bacteria can lead to more inflammation, lead to more metabolic dysfunction. What we also want to think about in terms of the gut is the function, right? And I'm going to keep it very, very simple. In terms of the function, we got the digestion, right? So with digestion, we have digestion enzymes, right? We have secretion of bile, and then all of these different factors can impact how well we break down and absorb our food. And of course, the microbiome will roll with that. And then we also have the integrity, right? Integrity of the barrier. And the barrier, essentially when we're talking about barrier, we're talking about the mucosal barrier, right? And we're also talking about the tight junctions. So the tight junctions are the one that regulates the passage of foods, right? So as food travels in the GI, travel the selective permeability, right? That allows which foods to be absorbed or get into the body is very, very important. If your patients are losing the integrity of their barrier or their function of the tight junction, then different proteins can cross, leading to inflammatory reaction. Next one is the motility and elimination, right? So motility and elimination are really important. For example, if your patient bowel movements is slowing down, that can lead to accumulation of feces. It will increase the risk of dysbiosis. Slower motility can contribute to SIBO, small intestinal bacterial overgrowth, as well as general dysbiosis that will impact the colon as well. We also talking about the immune interaction. So we have the GALT, right, which is the gut immune crosstalk. So that's the GALT. And remember that about 70% of the immune system is in the gut. So that is really crucial for modulating inflammation, healthy inflammatory response, tolerance to different foods, for example, and then also autoimmunity. The sixth part is the enteric nervous system. So the enteric nervous system. And when I talk about enteric nervous system, I essentially talk about our second brain, which is in our gut. This is where we have regulation of motility, secretion of certain peptides or hormones, right? So for example, a lot of patients struggle with weight gain. They go to a practitioner, they get a GLP-1 agonist medication, and what so many of those practitioners forget sometimes is that GLP-1, our body secretes GLP-1 in a natural way, right? The question is, why did we lose that secretion of GLP-1? Why did that reduce significantly to the point where the patient's starting to gain weight, right? Same thing with adiponectin and leptin and all those hormones that impact our body weight. And of course, we also have with the enteric nervous system, we also consider the bidirectional communication with the brain, which is, we refer to the gut-brain axis, and that's a very fascinating, very important for healthy brain function to learn more about the gut-brain axis as well. So let's get back to talk about how do we support our gut. Now that we understand the core principles here, which is the 6 concepts and principles around the gut, let's go back to the slides so we can talk about that. So there are a few recommendations that we can talk about. The first one is L-glutamine for gut barrier repair. And this is really important. And there's both animal and in vitro interesting studies showing that glutamine modulates the intestine permeability, enhances the tight junction protein expression, and reduce the gut mucosal injury. The clinical benefits, obviously, one, it's a primary fuel for enterocytes and the immune cells, right? It also supports regeneration of the lining of the gut, reduces the risk of intestinal permeability, what some people refer to leaky gut, and decreases inflammatory markers. It's found in several foods. However, most practitioners would recommend it as a supplement where you can get it in a concentrated amount between 5 to 10 grams daily. It is best absorbed in powder form in water. Here's a professional grade supplement that you can consider. It's got L-glutamine in free form, which is 3 grams per serving. And we typically will do 1 to 2 or 3 servings throughout the day, about 3 grams each time. You can do 3 to 6 grams each time. And then here's a really interesting study if you want to read more about as a review published article. This is called Current Opinion in Clinical Nutrition and Metabolism Care. It was published in 2017. Another one is magnesium. Now, magnesium is so important for over 300 biochemical processes, multiple cellular processes in our body, but we refer to it as the bowel regulator. Now, there's multiple types of magnesium. Some are better for brain health, some are better for cellular function, some are better for our bowel movement. So here's 3 examples. Magnesium citrate has a gentle laxative effect, typically 400 to 800 milligrams per day. Magnesium glycinate has better absorption but less GI effect. Magnesium oxide has a stronger laxative effect, but it is poorly absorbed. So this would be really, magnesium oxide probably would be more focused on in supporting or stimulating bowel movement. And typically, again, that will be 400 to 800 milligrams per day. Some magnesiums are better to take before bedtime because they have a more relaxing effect. Here's a professional grade product. And here's a pro tip for you. I found over years of practicing that using the triple magnesiums. There's multiple different products out there, but here's an example by Integrative Therapeutics. Tree Magnesium contains 3 types of magnesiums. Those would vary depending on the products that you pick. It takes the pros and cons of each type of magnesium and gives you a diversity of different types of magnesium for GI effect, but also some systemic effect as well. And this is a really cool article to read more about the improvement of bowel movement with magnesium, published by the Journal of American Heart Association in 2022. The third one is prebiotic fiber. So prebiotic fiber, we call it the microbiome fuel. And this is really a specialized plant fiber that feeds our microbiome, our beneficial bacteria, and enhance the gut function. It does that by giving them the food that they need, literally the food that they need to consume to ferment what we refer to as short chain fatty acid, SCFA. And one of those, for example, is butyrate. And when we dive into the advanced functional and clinical functional medicine program, certification program, we talk a lot more about the different short chain fatty acids. When you test your patient's stool sample, right? When the lab tests the sample of your patient, they can tell you, give you a snapshot of their microbiome, their different metabolites, and that tells us a lot about what's working and what's not working in your patient's body, so we can identify the root causes. It's also important for strengthening the tight junction between the intestinal cells, which will reduce permeability. So there's different types of prebiotic, and they will typically be used for different situations, medical situations. But you have inulin is one of the leading one. You have resistant starch. You have arabidinogalactans, right, which are slower to process. So there's different types of fiber, but in general, all of these fibers would be recommended through foods, right? So we want to encourage consumption of fiber, vegetables, and fruits with our patients. And then you can also recommend, where needed, a supplement which is easier for most people when they're on the go, they got a busy schedule, or maybe they don't cook much at home. So easier to consume. It's called Paleo Fiber by Design for Health. And you can get 10 grams of concentrated fiber in each serving. And they can mix that with juice, or put it in their shake with berries and almond milk, right? So those are really great recommendations. And I used to recommend doing a morning shake for a lot of my patients to boost up the consumption of fiber and phytonutrients. And then we also have, of course, probiotics, which are well known. The probiotic has 2 strategies. We got the general support for gut health, and then we have, as you refine your skills as a functional medicine practitioner, you learn more and more in our program about more specific or targeted probiotic therapy, which means when a patient shows up, and they have arthritis or type 2 diabetes or headaches or IBS, you learn about more specific targeted probiotic species for each one of those, right? Again, we want to get better clinical results for our patients. Now, probiotics are really important. When you take probiotics, it is the simplest and fastest way to restore microbiome balance by introducing those beneficial bacteria, reducing inflammation and modulating that immune function, and then also supporting important digestive functions. There are several probiotics that in general health concept could be beneficial. For example, Lactobacillus rhamnosus GG. There's multiple studies on it. And then there's other here that I mentioned that could be really beneficial. And you typically want a product that has at least 5 to 10 billion colony-forming units, they refer to in the supplement industry. Because if you go lower than that, the benefit for adults, the benefit might not be as noticeable. And then here's a professional grade supplement. We're not affiliated with any supplement company, but this is another professional grade supplement by Dr. McCullough, which has 70 billion CFUs of these very beneficial bacteria that are evidence-based. Again, that's our approach, evidence-based. This is, again, a very general recommendations for gut health. And here are a few recipes that you can recommend to your patients. Breakfast, green banana smoothie. Lunch, lentil and garlic salad. Got lots of those prebiotic and inulin-rich foods. Coconut yogurt parfait, which has fermented coconut yogurt. It's got antioxidant and omega-3s and fiber. And then you have dinner, salmon and asparagus, which is great with prebiotic, resistant starch, and sweet potatoes for resistant starch, and of course salmon, which has omega-3s. So in general, these are the 4 top recommendations. So you got the L-glutamine, magnesium, prebiotic and probiotics, and if needed for supporting healing of the mucosal, if there's damage to the mucosal lining, then DGL. If you want to learn more about functional medicine approach and precision medicine to get better clinical results and offer unique services such as functional and integrative medicine, check out our Advanced in Clinical Functional Medicine program. Thanks for watching.